For 2 decades, Vizient experts Julie Cerese and David Levine have studied what sets top-performing health systems apart. Their research across 8 national studies has identified consistent behaviors and practices that drive excellence in quality, safety, variation in care, and patient experience. Joining us today to discuss this research and Vizient's current work, Roadmap to Top Performance, is Julie Cerese, Group Senior Vice President of Performance Management and National Networks at Vizient. I'm Shannon Hale with Vizient's Performance Improvement Programs team and your host. Julie, welcome to the podcast.
Thank you so much, Shannon. Super excited to be here with you today.
I'm interested to hear how this body of research around top-performing organizations came about. What prompted you to ask that question, what separates top-performing healthcare organizations from their peers?
Going back to its origination, it was 2005. It's a long time ago. At that time, healthcare boards were asking the senior leadership, how do we know as an organization that we're providing high quality and safe care? How would they, as a board member, have evidence that would support that organization was performing at the level that was expected? At that time, we had benchmarks through the CDB. We had them for a number of years. And so you would be able to size yourself up against those benchmarks. More importantly, the question was, what are the things that we should be doing as an organization that are going to lead us down a path to achieving high performance? In 2005, we pulled together a multidisciplinary group. It was all types of personnel leaders, and it included their chief quality officers, but we also had COOs and CFOs and CEOs. They helped us think about what is the central question to this study, and then how would we go about conducting the study. We had 2 books written by Jim Collins. One was Built to Last, and the other one was Good to Great. When we thought about this study, we said, how do we mirror the methodology that was actually used in both of these research studies on businesses that had gone from good to great? The question for us was, what are the characteristics and the differentiating factors of top-performing organizations? We didn't have a methodology to understand organizations' performance. When I say performance, I mean in a more of an aggregated way. We could look at individual performance metrics, but we wanted to assemble a set of metrics that would be resonant. The IOM, the Institute of Medicine, had identified this construct for evaluation, and it was called STEAP. We took that STEAP methodology, safety, timeliness, efficiency, effectiveness, equity, and patient-centeredness. If the IOM is promulgating that construct, how would we take that construct, apply it with what we had, the data, and then be able to assemble metrics inside of that construct, gross that information up into one score? The first part of the project that allowed us to say we're going to be able to rank performance so that we could understand those defining characteristics. That was the second part of the study. The first part of the study was, hey, let's just get a measurement methodology that would help us understand how organizations were performing. Aligning with STEAP, we came up with mortality, safety, efficiency, effectiveness, and patient-centeredness, 5 domains. Built the metrics that we had available to us to be able to assemble a score for each one of the domains and then aggregate that score up to an overall score. That allowed us to rank organizational performance. I was a part of the research team. And when we were assembling the methodology, we had a group of people that were identifying the metrics and the measures that would go into each of the domains and what that would look like. The second phase was to identify the top and the middle performers. This part of our research team went into a room and said, let's identify these organizations, hand those names over to the qualitative researchers, and then went into those organizations completely naive to who was middle and who was top.
Wow. So it's kind of a blinded situation.
Totally blinded. And so much fun because when we asked the organizations to participate, they also did not know if they were top or if they were middle.
Interesting.
The organizations we chose to go out would assume they were top. They were all what I would call premier, marquee healthcare organizations. And from their perspective, they would have said, we're a top performing organization. But 3 of them were in the middle and 3 of them were at the top.
You mentioned 2005 as the starting point for this. I'm sure you've seen quite a few examples of what top performance in action looks like. Is there one example that comes to mind around this that embodies what a top performing organization is and looks like?
Fast forward, right? We've conducted 8 studies. We have an organization that has done remarkable work over these 20 years, using the findings from the original study to guide their practice and their behaviors, how they operationalize their work. And that's Methodist Houston has done a remarkable job, specifically around one of the key findings, which was alignment and a shared sense of purpose. The thing that is most unique about top performing organizations, they are very clear in their objectives, how it relates to their mission. And each individual in the organization, no matter where they sit, greeting people, to the nursing unit, to the surgical suite, all the way up to the executive team and the board, they all understand what their specific role is in helping that organization achieve top performance. This whole notion of shared sense of purpose, one of the findings from the original study, is the seminal finding, understanding who you are and how each individual in the organization contributes to the success of that organization. Methodist Houston took the original findings from the study and applied them, put all of them into practice, not just a shared sense of purpose, but a leadership style, a focus on results, accountability, and collaboration. For probably the past 5 years have been a top performing organization, and not just their flagship hospital, but all of the hospitals in the systems are performing at a level that is pretty impressive.
Yeah, all from that work. One thing I would like to ask you about, and it's a story that I've heard about around those first blinded site visits. Can you walk us through what that process looked like and when the team started realizing there's really some clear differences between top performers and average performers? Can you speak to that?
6 of us went into each of these 6 organizations, and we interviewed individuals from the top of the organization to the front lines. At the end of the 2.5-day visit, we were questioning individuals about what was unique about their organization. We're asking both the mid performers and the top performers the same questions because we don't know who is mid or who is top. We're assuming everybody's top. We're asking them what makes you so special, what makes you so unique. After the 2.5 days, we would go out of the lobby doors, standing right in front of the driveway of the hospital. The 6 of us would literally say, so what do you think? Top or mid performer? In all 6 of the cases, we successfully identified who were the top performing organizations and the mid performing organizations. What we heard from those individuals was not just telling a story, but their passion about how they exemplified some of these characteristics and what they did as an individual or as part of a team was palpable. Their energy was palpable, and we could feel it, and we could see that everybody in the organization was aligned. When we talked to the organizations who were not the top performing organizations, it wasn't that they didn't have some of those characteristics, but they were reliant on other things that ultimately weren't as important as the 5 things that we found in the study.
Very interesting.
It was interesting.
What have you learned about the role that leadership and culture especially play in sustaining top performance? What consistently shows up in those organizations that sustain excellence over time?
One of the leaders that we met in 2005, we found from the original study was that the CEO needed to be highly visible in the organization, that people need to know that individual. They needed to know and understand their passion for the organization's mission. They needed to hear it, but they also needed to see it. We heard this story from all kinds of individuals. It was a legend. This CEO was sitting in her office, and it was a snowy day in northern Wisconsin. The valet parking was building up. There were cars that were parked down the entire driveway that was the entryway to the hospital. She looked out her window and she saw all of these cars backed up, and she went to the front of the building and she started parking cars. It wasn't that they didn't have the proper staffing for the day. It was that the snow was forcing people to valet park and they needed more valet parkers on that specific day. It sent the message that anybody could do anything for any patient at any time. We heard that story over and over again, told by a number of people. Fast forward to 2010, where we did our next study. We found that it wasn't just the CEO, right? The CEO can set the mission and vision. They can light the fire, but the other people have to carry the torch. There were others in the organization equally as important to the CEO. All of those leaders that sit around the executive table in the hospital play a vital role to helping the organization achieve success. Another study that we conducted in 2014, we found passion for the organization's mission and vision has to be ignited at the department level. People have to really understand it, embrace it, and acknowledge that they, as an individual, play an important role in the organization achieving its success.
I'm sure it's probably easier to adopt that at the unit level when you see the CEO carrying out items like what you just spoke about.
Absolutely. It actually makes you accountable to that level of passion.
As you were telling that story, I was thinking, how would I react if I worked in that hospital and I saw the CEO doing that? I would think, we're all in this together. I'm going to pitch in wherever I can, whatever I need to do.
Funny that you say that, because a follow-up to the story that we heard was the CEO doesn't get to park cars for very long. They get to park cars for a little bit. And then there's a lot of people that run to the front of the building and they start parking cars.
That is a great story. Love that one. I mentioned earlier, Vizient's going to be having a roadmap to top performance benchmarking survey. We know many organizations are doing engagement surveys or culture of safety work and operational improvement efforts. How is this benchmarking survey different, and what's it designed to measure?
Why are we actually undertaking this? We have been studying top performance for 20 years. We know the things that lead to organizational success. And then the question is, so why can't everybody adopt those things? Why wouldn't everybody use that playbook? It's important to understand that there are things in the organization that actually inhibit forward progress. This survey is a way to more deeply understand the component parts. So I talked to you about the 5 characteristics. Well, there are some unique features inside of each of those 5 characteristics. And there are things that the organization will demonstrate. And there are things that you as an individual need to demonstrate to actually help the organization achieve success. This survey is a survey of leadership behaviors. Some people have asked, well, is it like a culture of safety survey? It has some facets of culture of safety, but it's not really culture of safety. It is about the demonstration of those leadership behaviors, how you see them, how you witness them in your organization, and how you as an individual contribute to them. We're going to be asking 30 individuals from every organization, 10 at the executive level, 10 at the administrative level, and 10 at the management level to complete this survey. We're not asking frontline staff to complete this survey. Frontline staff get the opportunity to complete the culture of safety survey. This is a survey that is allowing the executives and the leaders to be introspective about how they're doing relative to these characteristics. At the organization level, you'll see where your gaps are, right? Do we have gaps in accountability on results, a shared sense of purpose? We'll see that at the individual organization level. Every organization is going to be able to see where their opportunities are. But in aggregate, when we gross all the data up, we're going to be able to see, are there things across the board organizations need some assistance with? And how can Vizient help there? We really want to more deeply understand. We'll be able to correlate this responses to quality and accountability ranking overall. Are there things that hold more weight? Things that you must do. If you don't do some of these things, you won't make progress. Mm-hmm. We're hopeful. We find that some are nice to have and some are need to have. And we want to be able to sort through that.
Can't wait to hear what comes out of that.
This is a big undertaking, probably one of the largest undertakings Vizient has attempted in several years. And it's something that it's not as though we're going to do the survey and we're going to be done. We're going to do this survey and then we're going to help to facilitate work that'll go on after that.
It sounds like the survey is not a one and done. As organizations participate in this latest survey effort, what are you hoping we learn from those results, both the individual organization level and across Vizient member networks more broadly? And why should leadership teams consider being a part of the survey?
You have to be very willing to accept the results and understand the information that's going to come from participating. I have to tell you, I'm so impressed. We probably have 200 organizations that are willing to take this on. I'm very excited that they are willing. They are going to receive individual reports that will be able to identify where they're excelling and where their opportunities are. It will be an opportunity to have a conversation. My hope is when people receive results that they're going to sit around the table with the people that have completed the survey to have a conversation about what they need to do as an organization to take steps forward. Throughout this whole process of developing the survey and then had to invite organizations to participate, we have been trying to level everyone up in terms of what those characteristics of top performance are and the strategies that organizations have implemented to improve the metrics and the quality and accountability rankings. What we've been trying to do is level everyone up so that organizations have a deeper understanding of what works and give them a head start on those things, and then also give them the opportunity to more deeply understand where they need to focus their energy and their efforts.
It would be interesting to see how everyone implements the pieces from the reports. And if suddenly everybody's a top performer, everyone's performance gets better, there's a huge impact possibility there.
Wouldn't that be great?
Yeah.
I think we're going to find that organizations are accomplishing a lot. So having the opportunity to dissect this at the aggregated level is going to be really impactful as well.
I'm excited to see the results myself. So fantastic. Julie, thank you so much for chatting with us today on our podcast.
I'm so proud of this work. Who would have imagined in 2005 the quality and accountability ranking would still be recognized as one of the most formidable measures in healthcare? Who could have even imagined that? The original findings from the study in 2005 would have sustained over time. Every study we've done, we come back to those original findings. Very proud to have been a part of developing this body of work.
You should be. The items that are taking place now as we look at the roadmap to top performance and the engagement that we're seeing here within Vizient from our members. I'm sure 20 years ago, you probably couldn't have dreamt of that happening. That probably wasn't on the radar at that point, but here we are. Kudos to you. Great work. Looking forward to seeing what the outcomes here are with the survey. And thank you again for speaking with us. And thanks to you, our listeners. Please join us for more knowledge on the go. Subscribe today, like us, and send us your comments at picollaboratives@vizientinc.com.